Hi everyone. We're starting Chapter 10, Antimicrobial Treatment. In this mini lecture, we will be talking about antimicrobial therapy overview. So to start out, I'd like to talk about the principles of antimicrobial therapy. They were really introduced as modern drugs in the 1930s, which was a huge revolution in the medical field. It gave us the ability to treat infections in a very efficient way. Antimicrobial drugs have worked very well to reduce the incidence of certain infections, but we have not been able to fully eradicate infectious disease, and there's a good chance we probably never will. A lot of this has to do with how quickly these bacteria can change. And today, many in the medical field are very worried about what we do when our antibiotics are no longer effective, and much of that has to do with the antibiotic resistance we see in many of the bacteria today. So within this principles, what is the goal of using antimicrobial chemotherapy? And the goal is really to give a drug to somebody who is infected that will kill that infectious agent without hurting the host cells. So it's targeted at the infective agent. So the drug must be easy to be given, so something that would be able to be taken easily, and it must be able to reach anywhere that that infection might be in the body. It also should be nice or kind to the host while being toxic to the infectious agent. So we want something that destroys the agent without hurting us. And then it must be able to be in the body long enough to kill the infection, but also safe and easily broken down so that we can get rid of it from our body and we don't have it in our body for longer than is needed. On this table, which is from your book, Table 10.1, there are the characteristics of what makes an ideal antimicrobial drug. Not all of the antibiotics will have all of these characteristics, but they should have many in order to be a good antimicrobial drug. Some of the ones that I think are most important obviously are toxic to the microbe, but not to the host cells. Also that it's microbicidal. It kills rather than just slows an infection. In addition to that, some of them that are very important, or at least that I think of, is that it is easily delivered to the site of infection. It's reasonably priced, inexpensive, and it doesn't disrupt the host health. That's really important. You'd hate to do more harm than good with the antibiotic. This is also a table in your book, Table 10.2, and this is some of the vocabulary words of chemotherapy. Some that I'd like to make sure that you pay attention to. For example, prophylaxis. This is the use of a drug to prevent an infection, so it might be given to somebody if they're going to be around people infected with a particular bacteria. In addition, we have the broad term of antimicrobials, which means that it is a very wide term regardless of the origin of what the microbe is. Antibiotics are natural metabolic ones that some microorganisms can inhibit or destroy other microorganisms, so they're produced by that. Then lastly, the narrow spectrum versus broad spectrum are two vocabulary words that I'd like you to really make sure that you know. Narrow spectrum means that it's going to be really effective only against a very small subset of bacteria. For example, it may be a drug that is mainly effective only on gram-positive, whereas a broad spectrum or extended spectrum tend to be effective against a wide array of microbial types that could be both gram-positive and gram-negative bacteria. And these are good vocabulary terms to learn. They'll make the chapter easier to understand. So where did antimicrobial drugs come from? Antibiotics are actually metabolic products from aerobic bacteria and fungi. So they're produced by these aerobic bacteria or fungi to inhibit competing microbes in their habitat. So they're actually produced by that for survival. They're often derived from the bacteria in the genre Streptomyces and Bacillus, and also from the molds in the genre Penicillium and Cephalosporium. And penicillium is the one, there was some contamination on a plate that was for a bacteria growth, and it was seen that it inhibited the growth of the bacteria. That's where penicillin came from. So when we look at this antimicrobial therapy, there's things that we need to think about before we actually treat somebody with antimicrobial therapy. The first is to know what the microorganism is that's causing the infection. That gives us an idea of what the target might be. And then the degree that that particular microorganism is susceptible or sensitive to certain drugs, and then also the overall medical condition of the patient. We need to make sure that what we're giving the patient is not going to make it worse than actually just having the infection. So we do need to test sometimes for drug susceptibility. This is especially common for bacteria that commonly show resistance. We don't want to treat somebody who has one of these infections with an antibiotic that will not work on it, that it may already be resistant to. So we have a number of different ways that we test for drug susceptibility, one of which is the Kirby-Bauer technique, which we will be doing in lab this week, week 10. So hopefully this week you'll get a chance to see this and what this looks like. So in the Kirby-Bauer technique, we spread the agar plate with bacteria, and then we place small discs that have antibiotics that are part of the disc in places on the plate. And then after 2 days of growth, we measure that zone of inhibition or clearing around the disc to see how well it works against the particular bacteria. We can also do antibiogram, which provides data for drug selection. And this one is really much less effective for anaerobic or fastidious growing bacteria. So this week what you'll see in lab is something that looks like this. You'll have your plate, your normal agar plate that has basically a lawn of bacteria. It should be a lawn just clear of bacteria. But then we've placed these discs that contain the antibiotic in it. And what you can see is that this is showing a clearing where bacteria is not growing. So that would be your zone of inhibition. You can measure this and see which particular antibiotic works the best against a particular bacteria. And this is from your book, this diagram, but you will see this in lab this week. It should make it fairly clear. Another test that we do for drug susceptibility is what is called the tube dilution test. And this is much more sensitive and also gives us quantitative data, particularly about how much antimicrobial or how much antibiotic we want to use to be effective, the lowest amount. So the antimicrobial agent is diluted serially in tubes of broth, so we do it in powers of 10. Each tube that is inoculated with the same amount of a pure culture, and we end up looking for what is called a MIC, or the minimum inhibitory concentration. This is the smallest amount of the antimicrobial drug, so the highest dilution of the drug that can actually visibly inhibit growth. So we're looking for the lowest possible amount of that drug that will still inhibit growth. And this is very helpful in figuring out an effective dose to give to someone while also weighing the side effects of what could be negative side effects of a drug. So when we look at the MIC and what is called also another vocabulary word, therapeutic index, we need to keep in mind that what we see in vitro, so in lab activity of a drug, is not always going to be exactly the same with in vivo or in the host effect. So failure of an antimicrobial treatment, when we talk about we might have tested it in the lab, but then when we give it to somebody we see something different. It may be the inability of that drug to get to the area that it needs to be to fight the infection. It could be that resistant microbes of the infection didn't make it into our sample that we collected for testing. And it also could be that the infection is caused by more than one pathogen. So what we had isolated and used in the lab may not be what is actually causing it in the body, and it may be resistant to the drug. So when we look at the MIC, we want to have a ratio, or the therapeutic index. This is going to be the ratio of the drug, the dose of the drug, that is toxic to humans as compared to the minimum amount that we have to use to dose somebody. So the smaller the ratio, the higher the potential for drug reaction. So we actually want a much higher ratio, meaning that it's much safer for the dose that we're giving. So if you see a therapeutic index of 1.1, that's a very small ratio. It means it would be a very risky choice to give somebody that. It may be toxic to them more so than fighting the infection. If you see a TI of 10, that's a much higher ratio. It means that it's probably going to be very effective at a dose that wouldn't cause issues. So you always want to find the drug with the highest therapeutic index because it would have the widest margin of safety for the patient. And then lastly on this, when a physician is looking at prescribing an antibiotic, there are many things that a physician would need to take into account. So they'd need to look at pre-existing conditions that might influence the activity of the drug. So sometimes people may have conditions that the drug would not work as well. History of allergy to a certain class of drugs. So if you're allergic to penicillin, amoxicillin probably would not be a good choice. It's in the same family of drugs or class. Any kind of underlying liver or kidney disease. Some antibiotics are much more difficult for the body to process. These are things that physicians need to keep in mind. And then infants and elderly and pregnant women, there's often special precautions that must be taken, some medications that cannot be used or in different doses. Also, need to be looking at the intake of other drugs because there are times that if you're taking one drug and then you add an antibiotic, it may be less effective or it may actually interact with the drug you're already taking. Any genetic or metabolic abnormalities that might affect the antibiotic or how your body responds to it. And then lastly, they're always looking at the site of infection, how the medication is administered, and the cost. So this was a basic overview of antimicrobial therapy. There will probably be at least one more lecture from this chapter. Hope that this has been interesting.